Hey there, it's Dr. Jim. Thank you for stopping by. My topic today, caregiver, care for thyself. Now, if you have been watching my videos, you know that I talk a lot about my mom. She was a hero of mine because she was a nursing assistant for 30 years in the same skilled nursing facility on the same floor, working with some of the same residents and families for almost 3 decades. So, I also saw what being a caregiver for 30 years did to her body and sometimes her emotions, although she was not a complainer whatsoever. Bad knees, 2 knee replacements, varicose veins, stressful days, getting home late, so on and so forth. That was years ago. And I don't recall too many people talking about caring for the caregiver back then. I don't know if it was a main philosophy for anybody, but today is different. We know the damage that stress can do to our bodies and our minds, to our emotions. Stress is one of the leading causes of death. It's always right around the 5th leading cause of death in the United States. And caregivers, if you are a caregiver, a nurse, a nursing assistant, a therapist, PTOT speech, if you're a social worker, a counselor, psychologist, psychiatrist, physician, you're a caregiver. And you are at a higher risk for stress, burnout, health problems, and emotional problems. And I applaud you for doing what you do. But it's good, that's why I'm talking about this topic, caregiver, take care of yourself. So what's the problem? It's kind of humorous, but not so humorous, I guess. I know nurses who will take care of everybody so incredibly well, except for themselves. I know physicians who also take wonderful care of their patients, but they don't pay attention to their own health, well-being, stress levels, substance use, you name it. Lots of caregivers take care of other people more than they take care of themselves. I think that's a thing. I don't know. There's probably a name for it, but it's escaping me. So many caregivers do report physical and emotional problems. Insomnia is one of the big ones. Terrible eating habits. And I'm one of those people. Although I've gotten better and better and better over the years, but you know, when you're driving around and consulting and going from place to place to place to place, I probably pass up 50 fast food places in a day. And they all look really good. And they are good. And you could only eat so many peanut butter banana sandwiches in your car. So a lot of healthcare professionals admit that they don't exercise. They come to work sick, and they keep those sick days for other things, right? But here's the good news. At any given time, we can stop and start turning things around. I've done it many, many times. I know you probably have, and I know that you probably can continue to do this. You can change your lifestyle. You can change your habits. You can engage in self-care. Think about it. Who is going to take care of you 95% of your life? It's you, and only you. So you have to take an honest look inside your mind, your heart, your soul, and you have to ask yourself some tough questions. When's the last time you exercised? How long have you been eating healthy? Do you smoke? How much do you drink? Do you exercise regularly? Do you take good care of yourself? Is it easier for you to take care of other people than it is to take care of yourself? So breaking old habits, very, very tough. Bad habits die hard. I try to look at all the bad habits that I have in my life, or at least the ones that are not so healthy. As I get older, I think I drop more and more bad habits, or sometimes I just replace them with something else. But we can drop some bad habits. It's not easy. It takes time. It takes patience. And it really does take commitment. So, caregiver, this is Dr. Jim. I'm asking you to take care of yourself. See you later.